Hi, everyone. Welcome back to Strategy Saturday. So today we're talking about dealing with those difficult patients and families. You face them probably every day, right? We've all had those patients that you only want for one day. They're the one a day and done crowd. It's hard to stay calm and relaxed when the patient or the family is, yelling at you or being demanding or just not compliant with anything you really want to do to help them. It's hard to stay empathetic and compassionate when you maybe just want to initiate some pillow therapy. So, how do you harness the power of the breath and remain calm and relaxed, right? In that situation, you're just all tensed up and in that stress mode. It obviously takes some practice and using that outside of those situations so that when you get into that situation, you are able to really go back to that um, relaxing 557 breath. It becomes a habit and it's just, who you are. So I found some tips from Angela Walker. So the first one is dealing with that difficult patient. Is it them or you? So figure out if it's really the patient or something that's coming from within yourself and your life. Example for me the other day, a patient was getting on my nerve and it was not the patient. I knew I went in stressed and overwhelmed, some stuff going on outside of work, and it trickled into that. So definitely was me. He was a little irritating, but not to the point that I kind of, you know, was was pushing it. So as I said, it's not always about the patient. Some things obviously can go on and create that perfect storm that you're just like, I can't handle this. So maybe you just need to excuse yourself for a moment, take that breath, think to yourself, what am I bringing, to the table? Second one is to acknowledge the situation. Sometimes you just have to speak out loud about the tension. Say something like, I feel like we're getting off on the wrong foot. And then maybe, figure out what maybe that tension was about and move on. Third one is to ground yourself. Yoga, Tai Chi, running, some other kind of exercise movement. We need to ground ourselves and have a better self care, as we've been talking about over the last few weeks. So, whatever you do outside of your job for stress relief can actually keep you more centered and more together mentally, which will help you on the job, right? So, the fourth one is to look through a patient's perspective. This one can sometimes maybe a little harder for us. If a patient is screaming at you or getting angry, it might just be their fears coming out, right? They have no control of what's potentially going on around them. Sometimes communication isn't the greatest either, not necessarily with nurses, but with doctors and what's going on. And we're the middle ground, right? So we kind of get whatever they're feeling comes out, and we're the one that's there to kind of take it, I guess. So your beliefs sometimes for what people are feeling at that time. Remember, it's their experience that not our experience that they're going through. So sometimes the conversation about where their anger is coming from, maybe it'll help them express kind of what they're feeling. So kind of looking at it through a different set of eyes. Going on with that is to let them tell their story, provide them an opportunity to tell what's been going on, delve into, what came out through all this, what's their distress. They're emotionally distraught. Sometimes we just need to console them and give them that support. Especially during COVID, we're not having a lot of family come in, and we are who they see and who is there to potentially support them. So let them tell you what's going on, and maybe you can support them in that way. Caring for them, but not carrying it, right? Remember that as well. Avoid that defensive posture. It's not about me, it's about the patient. The kind of thinking has kind of get you through some of the situation. Refrain from thinking about your feelings, and don't blow up with them because of your own frustrations, right? Same thing for us being who's in front of them to take kind of the brunt, kind of can go the opposite way too. Might be mad at telemetry that this called you for the fifth time, and you go into the room and the patient's pulled his leads off again, and it's really you're annoyed at telemetry because they called you, maybe a little bit with the patient as well, but just be, going in there with the right attitude. The seventh one is to find an opportunity for empathy. So it's kind of a powerful skill to have genuine empathy, right? If your patient's tearing up a little bit, you can hand them a tissue, It makes them feel as if you're really trying to understand them and that you potentially care for them. Set some boundaries. So if someone's using profanity or screaming at you at the top of your lungs, set those limits. Say something maybe like, there are certain things that we allow here, and in order to continue to talk to you, you cannot use that language. I will step out of the room for a while to give you time to calm down, and then we can come back and address, what's going on. Set that kind of boundary, and then step in sometimes. If they're yelling and screaming and cussing out someone else that's on the staff, sometimes they need someone else to step in. I am not one that likes confrontation, so sometimes I'm like, I really wish to stop, but I don't verbalize that. So you might have to set the boundaries or ask someone to help you with that if you're uncomfortable. The ninth one here is to realign your body language. So when I get frustrated, I'm not making progress with the patient. Sometimes you need to take those breaths, right? We need to refocus. If the patient's becoming demanding, sometimes we get a little frazzled. Our energy goes into, dealing with whatever they're saying and not kind of focusing on what really is the top priority, keeping the patient safe and getting them to a healthier person, right? And you need to realign your body language. When we get tensed up, then, take that breath and relax, right? Make sure you're practicing this when you're not in those situations, though. So as I said, it'll be second nature for you to go to that point. The 10th one and the last one here is to find extended help for the patient. So sometimes they just need someone other than you to help them with their anger. Maybe they're having emotional breakdowns or difficulties. Social worker, a chaplain, maybe the psychologist, if there is something else underlying there. Make sure you're getting the patient the help that they need. Remember, they're always going to be difficult patients, right? Some of them come in with mental health issues, depression, anxiety, all kinds of complications. We don't know what's going on in their home life. We don't know their lifestyle. All that kind of plays into, the patients that we get. But each patient does deserve the best nursing care we can give them. So sometimes we need to calm ourselves, be objective, but be honest, show some empathy, give them our attention and time, and that maybe can make a big difference in their attitude and maybe even, soften their hard edges a little bit toward us. So take a few breaths during those hard situations. As I said, step aside, take a music break in the stairwell, listen to a song, reframe the situation, obviously looking at it from the patient's perspective. Use your bag of those relaxation techniques to kind of help you through as well. Remember the power of the breath, keep practicing. So join me next week for Strategy Saturday, where we will explore how to navigate the challenges of everything. Everyone have a great weekend.